Good afternoon. Welcome once again to our Beyond Black History Month for the month of May. And we welcome you and thank you for joining us for this continuing series of wonderful programming. We've got another wonderful program scheduled for you today. So I'm going to quickly get out of the way and hand this off to our education peers, Jean and Linda Crow. Thank you, Jean and Linda.
Thank you so much, David. I'm going to add myself to the spotlight for a minute just to give a few directions to everyone. This is not going to be a college lecture, although everybody participating has the ability to actually present as a college lecturer. This is going to be an informal but informative meeting. To watch it in the best way possible, I'm going to make a couple of suggestions. Please mute yourself. And actually turn off your camera too, because sometimes it interferes with a video that might be shown. And we're going to go ahead, and if you have questions, we're going to save them to the end, but hopefully you'll put your questions in the chat as you think about them. And I'm going to turn the program over to Jean so that he can introduce our first speaker. So Jean, your spotlight is on.
I'm going to introduce Jacqueline Ray. She's a PhD doctor, and she has more than 30 years of experience in higher education. She has concurrent experiences in mental health consulting, counseling, and human services training at Columbia University Kohler Hospital Project, Jersey City Board of Education, New York City Department of Mental Health and Mental Retardation, New York City Housing Authority, the U.S. Department of Labor, and the U.S. Department of the Interior. She will introduce our special panelists, Dr. Washington Hill, Dr. Ray Taylor, and Fran Taylor with a BS and nursing degree. Dr. Jacqueline, the program is yours.
Thank you, and may I express my gratitude to my sisters and brothers of the Minnesota chapter of VASALA for this invitation to serve as moderator today. An important topic, and we are so glad that you are joining us. I thought it might be appropriate to give a little background, and as some of you who know me well know, that I don't often read, but I thought it important to share, and I am choosing to read some background that I believe will help you to better understand how this topic's title was selected. In 2004, the Sullivan Commission on Diversity in the Healthcare Workplace issued a report that was entitled Missing Persons, Minorities in the Workforce. The commission was chaired by Dr. Lewis W. Sullivan, who served as U.S. Secretary of Health and Human Services from 1989 to 1993, and is President Emeritus of the Morehouse School of Medicine. This commission determined that at that time, 2004, there was an imbalance in the makeup of the nation's physicians, dentists, and nurses. Specifically, the report found that African Americans and other minorities were not present in those professions in significant numbers. In fact, the report concluded they were missing. As students of history, I know that we have several questions about those findings, to include what are some of the factors that contributed to this imbalance? What was the impact on the quality of healthcare then? And where are we now? To address these and other related issues are our esteemed panel members. You've already been informed that Dr. Washington Hill, Dr. Ray Taylor, and Mrs. Frances Taylor are here today. All, I am proud to say, are members of this Minnesota chapter of ASALH. Each of them will come before us individually with a presentation, and it will be my pleasure to introduce them prior to their remarks. We will begin with Dr. Hill. He received his MD from Temple University School of Medicine and completed his residency at the William Beaumont Army General Hospital in El Paso, Texas. After 12 years in private practice, he completed a fellowship in maternal fetal medicine. He holds academic appointments in a number of prestigious schools and universities around this country and elsewhere. Dr. Hill has a strong interest in education, patient care, and clinical practice. And as many of us know, he is a regular participant at conferences throughout the country. He is an expert in the areas of health, equity, diversion, diversity, and inclusion. Dr. Hill, we are so pleased to have you with us this afternoon. Will you begin?
Well, first of all, I want to thank you all for inviting me to participate in this discussion. I'm going to focus my 12 minutes on answering a question. And the question is, why is it important to have minorities in the healthcare professions? Why is it important at all? And if we look at if you can show my one slide, there it is. If you can enlarge that, it would be very helpful. One more. I'll keep going. If you can put it on the slide view, that would be helpful. If we look at the 5 factors that contribute to healthcare inequities and disparities, they're shown on the slide. And I can pick out many disparities, but as an OBGYN and high-risk pregnancy doctor, and because there's so much about it in the literature and in the newspapers now, we can talk about the disparity in maternal mortality. I was just at a meeting yesterday in Orlando, and we looked at maternal deaths in the state of Florida, and the state of Florida is no different than the rest of the country. The maternal mortality ratio is 4 times higher. That's the ratio of patients who die, 4 times higher in Black women than in white women. So let's look at the factors that contribute to disparities. The first that you see is healthcare system factors, then patient level factors on the left. In the middle is clinical encounter factors. Down at the bottom are the social determinants of health that we all know about. And the last is provider factors, which is the focus of this discussion. And what I've done is to underline one of the main sub-factors in each circle. And note that all of these circles intersect. And in terms of health system factors, healthcare organization and culture are very important in your health and in your healthcare. We know that. If the hospital is a good practicing hospital, you are more likely to come out of that hospital doing well. Unfortunately, in many of the areas of our Black and brown patients and colleagues and friends, that care is not as good as it could be across the street. The second is the patient level factors. How do the feeling of the patients play a role in all of this? And what I underlined there was racism and ethnicity, and we'll come back to that in a minute. Clearly, patients like to be taken care of by people who look like them. That's why so many of you have asked me, Dr. Hill, do you know of a Black pediatrician or a Black cardiologist? And unfortunately, sometimes the answer is no. The other important aspect of patient factors that affect our health is their belief. Think of all the work that you and I and many have done in terms of vaccination. Well, if you don't believe that vaccinations are necessary, then you're not going to get one. And unfortunately, that affects someone's health, particularly if they get COVID. The third group of factors are clinical factors. You can see that in the middle: provider communication, cultural competency, and cultural humility. And these are clinical encounter factors that can affect health. We pick out one: provider communication. There was a patient yesterday that we discussed. She needed to go back to the hospital, and she said, no way, no how. That doctor did not communicate with me. I'm not going back. And unfortunately, that cost her life. So clinical encounter factors and provider communication is so important. And then social determinants or drivers of health. You know what they are. They are factors that occur because of where we live, work, who we love, where we go to church, where we go to the market, etc. And those social determinants of health are still with us. I'll pick out one: where you go to market. The folks in Buffalo had one market, and that was Tops. Now Tops is closed. There is no other market. I think they said there was a mom and pop shop. So fortunately, the good folks of Buffalo have been making sure that food is brought in, Uber rides are possible, etc. But you can look and see the social determinants of health: poverty, wealth. Doesn't where you live, your zip code, affect health? It shouldn't, but clearly it does. Unemployment. If you don't have any money, and you may not be able to pay for your health care, if you don't have any employment, you don't have insurance, and you know the rest. And you are more likely to use the emergency room as your primary care physician, and that runs up the cost for the hospital. We'll come back to that in a minute. Food security, and clearly racism. Racism, as David would tell us, plays a role in all of this. Structural racism, institutional racism, personal racism, etc. And then the fifth factor is the factor that Lou Sullivan brought to our attention, and that is provider factors. And those factors include knowledge and attitudes. Had a case yesterday. The doctor simply did not do the right thing. And that was because he had a lack of knowledge. And then there's the attitude of the physician, which can occur because of racism. A friend of mine has said, and you've heard it before, if we don't accept the fact that racism exists in medicine, we will never, ever correct the disparities and the diversity. It just won't happen. Knowledge and attitudes, competing demands on the physician, frequently that is the operating room schedule, and then implicit and explicit biases by the provider. And then the big one that Dr. Sullivan has mentioned, and that is the race of the provider. The race of the provider. Even though white and other ethnicities may feel that they are not racist, we know that they can be and frequently are. So we need more physicians, pediatricians, cardiologists, et cetera, because the evidence would show us and tell us that when a Black person, Black woman is taken care of by a Black obstetrician, Black woman is taken care of a Black cardiologist, more likely than not, the study says, best practices will be used and their outcome will be better.
Dr.
So
Ray, there's
there-
about 2 minutes left.
Yes, sir. So that those are the 5 factors. And as we look at our community, we can see that the health system is good, may need a little bit of help, and that's one of our jobs. That patients should be interested in going to the hospital, that the clinical encounter should be good. We should show some humility. And then that we should deal with the social determinants of health and hope that we find a way to increase the number of providers that look like us. And as we do that, we will find that we have better outcomes and less disparities. Thank you very much. With 1 minute to go.
Thank you, Dr. Hill, so very, very much. As some of you can hear, we do have a timekeeper. And please be assured, you have been invited to put your questions, your comments in the chat room. Please do that, because it is our intention to give you as much opportunity as possible to be participants to the discussion as we come closer to the end. Thank you again for this information. As we continue our presentations, I am now honored to introduce Dr. Ray Taylor. Many of you may know the Taylor Quad. I say the Taylor couple today, and I am honored to say that Dr. Ray Taylor is a retired lieutenant colonel, having served with the United States Army Dental Corps, having received initial degrees at Indiana University, both his baccalaureate and his DDS, having done further work at Boston University, and holding board certification from the American Board of Oral and Maxillofacial Surgery. He has a 42-year professional career in dentistry and has had a number of positions across that period of time, having served as a chief resident in oral surgery in Harlem Hospital, also at the Fifth Avenue Oral Surgery Center in Indiana, and many others. We are delighted that he joins us today to talk more about the disparities and where we are. Dr. Taylor, please take it away.
Good afternoon. Is it possible to enlarge that first slide? Can our technical team answer that? If not, then I will proceed as best I can.
We can see it the whole screen.
You
I don't
can?
know.
Okay.
Yeah,
Fine.
sorry.
Okay, first let's just get into just a little bit of a history, the history of dentistry. The first doctor to receive the DDS degree in this country was a gentleman by the name of Dr. Robert Tanner Freeman. He was a native of Washington, D.C., and he was the son of slaves. And just after the Civil War ended in 1967, after being mentored by a white doctor by the name of Dr. Henry Bliss Noble, they decided that he should apply to be accepted in dental schools. He was rejected by 2 dental schools, but fortunately, Dr. Noble had some influence, and he was finally accepted and graduated from Harvard University School of Dentistry, therefore becoming the first African-American dentist in this country. Unfortunately, after receiving his degree, he only practiced for the 4 years in the Washington, D.C. area. And his unfortunate demise came because of a waterborne disease where we don't have too much information about what that was. Fortunately, right with him in school and 1 year behind him was a Dr. George F. Grant, who also entered Harvard University School of Dentistry in 1970 and graduated from there. Later on, he became the first African-American faculty member of the Harvard University School of Dentistry. He was an expert in cleft palate procedures. He was actually a pioneer and actually improved what you golfers would know about the efficiency of a wooden golf tee. May we have the next slide on the first Black female dentist? Okay, I see that, yes, the first Black female dentist was a young lady by the name of Dr. Ida Gray Nelson Rollins. She finally graduated from the University of Michigan College of Dentistry in 1890. And fortunately, her mentor wanted women in the class, and she was one of just 3 women in that class at the University of Michigan. She became the first African-American woman dentist in the USA. She was born in 1867, but as happened frequently during those times, she was orphaned as a teenager. She never knew her father, who was white. But after becoming an orphan, she moved to Ohio and was raised by her aunt, where she worked with her aunt as a seamstress and dressmaker. Later on, she was also working in the office of a white dentist by the name of Dr. Jonathan Taft. She was mentored by Dr. Taft, and he was very important in getting her accepted at the University of Michigan College of Dentistry, where he was the dean of that college. She practiced both in Ohio and later on in Chicago. And she died in 1953, but she lives on because the University of Michigan gives a diversity award in her name annually. May we have the next slide, please? What has happened since then? If we look at this slide, we can see that over time, ethnic and racial diversity among dentists does not mirror that of the US population. We look at the chart on the left, we can see that Hispanic and Black dentists, as well as dentists who identify themselves as others, are proportionately less represented in the profession when compared to the US population. If we look very, very carefully, we can see on the left that the white population of dentists right now, the white population in this country is 60%. The Hispanic population is 18.4%, Blacks are 12.4%, the Asians are 5.6%, and the others are 3.6%. But if we look at the graph on the right, we can see that although the whites are only 60% of the population, they are 70% of the dentists. Amazingly, the Asians, who are only 5.9% of the population, are represented by 18.4% of the dentists. Blacks, who are 12.4% of the population, are only represented by 3.8% of the dentists, and the Hispanics are also underrepresented for their numbers. May I see the next slide, please? Fortunately, we are finding out now that the females are coming on. In 2010, females only represented 24.1% of the dentists, and now they are already up to 34.5%, and they are on the move. Things have changed. When I first went into dental school in 1961, I looked around and there was only one Black and one female in the class. The females have done much better than the Blacks, and they are now on the rise. Next slide, please. Okay, here we see the what has happened over the years. Looking at this slide, we see that in 2005, the population of the white race on the right was 67%, but they represented 79.8% of the dentists. The Asians, who are only 4.2% of the population, had 11.8% of the dentists. The Hispanics were underrepresented. They were 14.4% of the nation, but only 4.2% of the dentists, and the Blacks consistently only 12.2% of the population and only 3.7% of the dentists. And we can see as we go downward, coming up to the present time, whites are represented at the bottom right, 60% of the population, but they are representing 70.2% of the dentists. The Asians, who are only 5.6% of the population, have 18% now of the dentists. The Hispanics, who have grown to 18.4% of the population, are still underrepresented by only 5.9% of the dentists, and Blacks, who represent 12.4% of the nation, are only consistently 3.8% of the dentists. Next slide, please. Now, there is a reason for this, we believe. We find that the racial mix of the dentist workforce, as we see on the left, does not reflect the US population. Black and Hispanic dentists are significantly underrepresented, while Asian dentists are significantly overrepresented. There's some reasons for this. We see the big percentage at the lower left. 43% of US dentists participate in Medicaid. Medicaid happens to pay the least of all the payers. In the top middle there, we see that the dentist workforce has diversified, but almost all of the diversification has been accounted for by the tremendous increase in the Asian dentists. Share of dentists who are Black, for example, has not changed at all. We find that some of the career choices are influenced by race. We see that Black dentists are more likely to participate in Medicaid, which pays less than any other of the insurances. And if we look carefully at the slide at the bottom, 63% of Black dentists will see Medicaid patients. It is about 50% for most of the other people, the Hispanics, the Asians, and the other races, where the whites, who are the best paid, only see 39% of their Medicaid patients. Next slide, please. And here we see that over the years, things have changed. In the year 2005, if we look at the distribution of our population by race, we see that 67% were the whites, and yet we see that they represented 79% of the dentists. 4.2% of them were Asians, but the Asians were represented by I'm just a little bit confused with this. The slide is
Dr. Taylor, you have about a minute.
Okay, let's go to the next slide. What we see is data shows that that the typical white family makes 8 times the wealth of the typical Black family and 5 times the wealth of a typical Hispanic family. Go to the next slide then. Okay, what do we see here in this slide is that the median net worth of whites is tremendously more than Blacks and Hispanics, and that the others are about in the middle. What this means is that if we go to the next slide, that Black dentists have the lowest incomes, even though they are making the least salary.
Dr. Taylor, would you have some concluding comments that you might wish to make before we hear yet again from our timekeeper? Thank you.
Okay, our conclusion here is showing that the people that the Black dentists are earning the least salary, and I think that this is explained by the fact that the Black population has the lowest net worth. So I think that we will conclude it with that. I think that the slides being small have kind of thrown me off a little bit.
So, we thank you, and I think as all of us know, flexibility, as I often say, is the keynote to success. And you certainly have added to our knowledge when we consider factors that might influence the numbers of Black dentists who are in that profession. Thank you so much.
Okay, thank you, Doctor.
I now turn to Mrs. Frances Taylor. Although affectionately called Fran, I would like to share with you, perhaps of the 3 presenters, I know her very well. I looked at the bio, and sometimes when you know a person, you don't know a lot about them, even when you thought you did. So may I share with you that she received her RN at Harlem Hospital Centers for the School of Nursing, a program I know well, Columbia University, her baccalaureate, and Valparaiso University in Indiana, her master's degree. Fran had a 41-year career in nursing at Harlem Hospital, and also serving as the Vice President and Chief Nursing Officer. She was at the Methodist Hospitals in Gary, and I believe it is Merrillville, Indiana, and also served as the governing board member, secretary, and quality committee chair for the Methodist hospitals in those 2 areas. Mrs. Taylor, please share your information with us.
Thank you very much, Dr. Ray. Pleasure to be here. This month, May of each year, nurses are celebrated. They're celebrated for being on the front lines, and being intimately involved in healthcare for Americans across the nation. As nurses, and maybe some of you realize, there's been a lot of emphasis on Florence Nightingale. And when you think of nursing, she is the one that most people think of. But we'd like to highlight today some of the nurses that have been forgotten over time and bring them to your attention because they played an essential role in the development of nursing practice within our country, and they need to no longer be unsung. The picture you see here is of Mary Eliza Mahoney, her years 1845 to 1926. She has the distinction of being the first African-American professional nurse. Now, she realized that she stood on the shoulders of many people that came before her who never got the recognition that they deserved as far as the development of nursing practice was concerned. Some of these people are Sojourner Truth, Harriet Tubman, Mary Seacole. There are nurses that participated in the Crimean War, the Spanish-American War, World War I, and on from there. But Mary Mahoney is being called out because she helped not only to practice nursing, but she also helped to organize support for nurses throughout the year. She, of course, was born in 1845. She was the daughter of two freed slaves. They had migrated north. And so they settled in Boston, where she had the opportunity to attend the New England Hospital for Women and Children's School of Nursing. Now, this particular School of Nursing said that they admitted African Americans. However, they really only admitted one or two each year. Now, Mary, before she got into this School of Nursing, had worked actually 15 years as a janitor, a cook, a laundress, just to be around the place where she could get some training. And at that particular point in time, the schools of nursing were located within hospital settings. So she faced discrimination in getting in, but she was one of the successful ones after a rigorous 16-month training program that was able to graduate. She joined the Nurses Association, Associated Alumni of the United States and Canada, which was the precursor to the American Nurses Association, and that happened in 1896. However, it was probably in name only that she was able to participate because she had no voice. As a result of her pressure to get support for Black nurses, she and one other individual founded the National Association of Colored Graduate Nurses, and that was in 1908. As a graduate from the School of Nursing, she was not really able to practice. She had to practice as a private nurse, many times to wealthy white families, where again, she was not able to practice fully. She was not permitted to practice in hospitals unless she took care of only Black patients, and that care was limited. So in addition to what she did, there were, and I mentioned earlier about the nurses that participated in service. One area was the area of the graduates that were present in the population. It was a small number, but they were not able to practice at all. And at the outset of World War I, they were not allowed to join nursing organizations, not allowed to participate in the Army Nurse Corps or the American Red Cross or any other organizations. They were barred. But they persisted, and they also got involved in a concerted effort to make sure that African-American nurses were accepted as practicing nurses. Now, it's kind of interesting for this particular group, there were many that were certified to work, but again, they were not permitted to work. And as regarding the war of World War I, in the last few months of the war, they were permitted to work, and also during the influenza pandemic of 1918. But none of these nurses received any benefits or pensions or anything that would recognize that they had served in wartime. So it was very difficult to practice, but many of these nurses persevered. And as a result, their organizations continued to flourish. And as I mentioned, the National Association of Colored Graduate Nurses was organized by Mary and others, and it dissolved in 1951, however. But the National Black Nurses Association was founded in 1971 and is still in existence, and certainly advocating for Black nurses. Since that time, next slide, please. May we have the next slide, please? Okay. There have been many other nurses that have distinguished themselves in service when opportunity has presented. As I mentioned, the schools of nursing were organized and a part of the hospital setting. And so there was a particular period of training for the nurses, and then afterwards they were permitted to function. But even as late as the late 40s, it was very difficult for Blacks to get into even the schools of nursing that were affiliated with white hospitals. A point of personal pride for me is looking at this slide, and this is of General Hazel Brown. She graduated from my school of nursing in 1950, but her acceptance in the school was a godsend, in that she had been denied entrance into other schools of nursing. One of which told her, we will never hire never have a Black person in our program. They never have had, never will. Fortunately, these obstacles were taken down over time, and she was able to complete her training. Joined the Army, distinguished herself as the first Black woman to be promoted to Brigadier General. You see her accomplishments, and she headed 7,000 strong US Army Nurse Corps, earned a bachelor's degree, a master's degree, and an administration PhD. and awarded numerous citations. And when you look at it and you think about it, the barriers that were in place would have prevented this individual and many, many others from the major contributions that they provided for us as Americans. Okay, looking at the next slide, please. This is one of our own, Colonel Ronalda Hobson, who was an ASALA member. Excuse me, my voice is bad. But she too distinguished herself in nursing, beginning in New York City, and going throughout her career, distinguishing herself in the United States Army. But very high quality, very high credentialed individual. As a matter of fact, when she became a full bird colonel in 1994, she was one of 739 potential colonels who, lieutenant colonels for consideration, and she was the only one selected. This is a high distinction. As you know, she participated in ASALA in our area and worked as the in the medical director area of the Florida Department of Health. So we want to recognize, I'm just letting you know that there are so many women that have served with distinction, and we are fortunate to have had some of them be within our midst. The next slide, please. Okay, this is Dr. Ernest Grant. He's the first Black male elected to the office of American Nurses Association president. And this is a milestone in nursing. As you heard before, Mary Mahoney was not able to participate fully in governance or leadership in any of the organizations that were in existence during her time. But this very organization is now being headed since 2018 by an African-American male. This African-American male started out as a licensed practical nurse and moved up the ranks in his education and training, and now is the head of the American Nurses Association. He serves as an example to men in nursing. He serves as an example to African Americans in the nursing profession. He promotes legislation and policies designed to improve public access to care. And he certainly is at the forefront of encouraging diversity in nursing. And he says—
Brian, you have 1 minute.
Okay, thank you. He says that, it's important that we diversify so that we can get the very best to serve our people. And to have this kind of representation at such a high level is a wonderful thing to have happen. Next slide, please. Okay, since Dr. Hill gave such a great presentation on disparities, I won't really concentrate too much on this, except to say the statistics don't lie in that, the African-American family and individuals are at the bottom of the barrel with regard to the disparities and the impact of disparities on health of themselves and their families. Next slide, please. Okay. I would like to highlight the fact that from a standpoint of nursing, we have a very, very positive outlook. employment over the next 10 years is expected to increase by 45%. So that means 195,000 essentially registered nurses can be hired every year through 2030. The median income for RNs is good. The increase in the Black presence is improving. The presence of men in nursing is improving. Nurses are in high demand, and they are highlighted as being the most trusted in the health professions. And this has been they've been the #1 position for 20 years. So the future for nursing is very bright, but the challenges are also there. We are not represented in the numbers that we should be within the population, but we are moving in that direction. And with the help of individuals and organizations, it is expected that we will be able to play a major role in achieving health equity for the citizens of our country.
And on that note, I apologize, but it becomes in part my role to also reinforce time. Thank you so much again for this very informative presentation. History and where we are and where we are going. Before I ask Linda if there are any questions or comments in the chat room, may I ask our presenters, are there any additional comments that you might wish to make specifically as they relate to hearing your colleagues speak?
David, would you stop sharing your screen?
And all of us who are present are very grateful for the technical support that we are receiving. Thank you so much. I go again to our panelists and simply ask, was there a parting word that you would wish to make before we open it up for possible questions and or comments? See, Dr. Hill?
Yes, I'll start. And I think a common message, whether it's physicians, dentists, nursing, and other careers, is that it's never too early to start. You can't be what you can't see. And you can't see if we are not out there encouraging our young folks at a very early age to be doctors and nurses and other professions. We just have to do that in our retirement ages. They need to know that there are Black nurses, there are Black doctors, and that they can do it. So that would be my, and I know in our community, the Booker schools, all 3 of them, and other schools as well, are more than willing to have any of us come in and show the students what they can be.
Visibility is so critical. Are there other comments that any of our panelists would have?
Yes, regarding dentistry, we find now that approximately 12.5% of the population is only producing about 3% of the dentist. And I think that the reasons for this are that our kids are not getting into the scientific mode as early as they should be. Also, it is a negative thing because of the disparity in wealth and the implicit bias showing us that so often other races will not come to the Black dentist the way they should, that we find that the Black dentists have the lowest income and the highest debt. The average Black dentist graduates with about $300,000 worth of debt. and yet he's making $20,000 to $30,000 less than his counterparts. The solution to this is very complicated. I don't know it, but I think that this is something that we have to work on. Medicaid pays very, very poorly to the dentists throughout the country. And to say that you have Medicaid when the payment is so low that the dentist has a hard time making a living from it is kind of a joke. And these are things that we have to work on. I'm sorry about the technical difficulty I had. The slides were small and I couldn't
That's
see
quite okay. Thank you. Thank you so
Thank you for
much.
having me.
Certainly. And Mrs. Taylor, would there be comments you would have?
Yes, there's a report that was released last year entitled The Future of Nursing 2020 to 2030. I've asked that the link be put in the chat box so that those who might be interested will be able to see it. But I think the gist of it is that we want to leverage the capabilities of the 4.3 million nurses in our country. And they, in collaboration with physicians and other healthcare practitioners, will have to make a concerted effort to deal with the issues that have been raised here today by Dr. Hill and Dr. Taylor, and that we need to get into the pipeline, as we said, the maximum number of individuals who are interested, give them the support that they need, not only as they train, but also as they practice, because people who are feeling good about their capabilities and their environment and in which they practice will be able to do a much better job for our country. This is a complex subject that we've dealt with, that we hope that it's piqued your interest so that we can have future discussions and elaborate more on the content.
With that in mind, may we take the opportunity now with gratitude to our panelists to please ask, Linda, are there any questions or comments within the chat box?
We did not receive any questions, although I have one, if you don't mind.
Please go forward.
All of you have been so marvelous in presenting what some challenges are. Tell us a little bit about your own journey. Who were their supporters out there who helped you achieve what you achieved? Because I think that's critical that we need to be doing for young people. Who championed you?
May we start, Mrs. Taylor?
Yes, I don't know if she's on the line, but one of the individuals that I invited is the wife of the president of the Methodist hospitals that I served at in Gary and Merrillville. And John Betjeman, who is now deceased, was a pioneer. He was ahead of his time in terms of some of the initiatives that he implemented at the Methodist hospitals. We were in Gary, Indiana and Merrillville, Indiana, two diverse communities, and he was challenged, and he came to us in the 80s. So there were a number of initiatives and a number of things that he implemented that really helped to improve and make possible wonderful healthcare to the citizens, not only of Merrillville, but also of Gary. And so I wanted to highlight him as an individual that was an inspiration for me. And of course, there have been many throughout my training and throughout my practice.
Thank you so much for sharing. Dr. Taylor?
Yes, quickly, there were two things that really influenced me. And first of all, I didn't get to talk about it, but debt after finishing school is so crucial. 20% of the Asians come out debt-free. Only less than 1% of Blacks do. My father, who was a country preacher, made sure that I came out of dental school and a specialty program debt-free. Secondly, to make the point about being stimulated by seeing people like you, and this is kind of funny, I didn't know what I wanted to do, but I dated a young lady who had a family that had physicians, pharmacists, dentists, and everything. And I wasn't sure what I wanted. And I told her that I didn't want to be up all night going to medical school. I thought about pharmacy. She said, no, you don't want to do that. I have a brother who's a pharmacist and he's stocking shelves just like a grocery store owner. But she said, I have another brother who's in South Carolina and he's a dentist and he just about owns the town. And I said, that's what I want to do. And that's my story.
And we assume that Mrs. Taylor has heard it before, but thank you so much for sharing. Yes.
Sure,
Dr.
yeah.
Hill, would you share with us who some of the people might have been that have influenced your journey?
Well, my folks are not as exciting as what was just mentioned, but I would, and I was thinking, I would think that I've had good mentors along the way in OBGYN and in medicine. To call the name of Dr. Ezra Davidson, who's passed, who was at King Drew Hospital, and then certainly Dr. Henry Foster, who was the chair and then dean at the Meharry Medical Center. And then role models, certainly I think a role model that I always look back on is Dr. David Thatcher. He has the patience of Job. So he taught me how to sit in a meeting and really don't say anything. And you probably will come out of that meeting far better than when you went into it. So those are the mentors that I would say have helped me along the way.
Thank you so much for sharing. And I am assuming as we have moved in fact, we are beyond 5 and we are so grateful. Before I turn it back to our committee, you will remember we started with the title, Missing Persons, Minorities in the Healthcare Professions. We talked about the Sullivan Report and the question was asked, are we there yet? Well, you have heard from our presenters an astounding and resounding no, we are not there yet. But you have also heard each of them with hope, and also sharing with us as members of ASALH some things that we might talk about. The flyer that presented this particular Beyond Black History topic shared that we were whetting appetites. The intention was not to answer all of the questions. We would not pretend, I think I can say for our presenters, to have all the answers, but we sure hope that those who have assembled and others will join in doing what Dr. Hill and others have said. Let's be there as people that our youth and others in the community can see as examples as we begin more and more, and I don't know how Dr. Hill feels about that and others who are here, but as we begin to move ourselves back into some of the schools and other areas, let us be a presence. Let us be the role models. With that in mind, I say thank you again for this opportunity to serve as moderator, and Jean and Linda, it is in your hands.
Thank you so much. I'm going to slowly unspotlight each one of you so that we can see everybody again. And it takes a minute, but I too want to thank you for your participation. I think it's been a wonderful, wonderful lesson. We have so much to learn and so much to do that eventually, oh, Ray, you're the last one to be spotlighted. So you can enjoy your spotlight for a minute, but I want to turn it back over to David and to Jean to say it's time for us to go ahead and switch to gallery view. We can stop the recording.
No, not yet.
Okay, Jean has something he wants to say.
I want to thank the participants today and let the audience know that we are finished with our Beyond Black History Month presentations for this calendar year. We will have our next presentation on September on the third Thursday of the month. I think the Education Committee needs new members to serve on the Education Committee. So in the audience, we want people to volunteer their time and their talents to be on the Education Committee so we can have a better program next year than we had this year. I want to thank the members of the Education Committee, David and Lois, Marion and Paul, Ray and Fran, and Linda and myself, I'll thank. I also want to thank our intern, Lauren Black. Lauren David. She was our intern from the first semester, and she volunteered for the second semester. And she's not going to be back next year as a committee member, but she'll volunteer her time and talents. I want to ask the ASALH audience to recommend topics and subjects for consideration for programming for next year, because these things that we've done were very exciting, very informative, and very challenging. And it all made us a better person for them. And I'd like to thank all of the participants for all of the programs this past year for their time and their talents and their enthusiasm. And with that, I think I'll turn it over to David to make a decision to stop the meeting, and we'll go on with the meeting afterwards. David?
David's computer probably failed on him. He said it was going, but he's back. David?
All right. Thank you, Jean and Linda. The membership of Manasota, ASALH, OU, and the entire committee, enormous debt of gratitude. This program, Beyond Black History Month, was envisioned more than a year ago, and none of us thought that it would be what it's turned out to be. And we know it will be even more magnificent next year. So thank you both for your leadership. Thank you all for joining us this afternoon. And please stay tuned for future Beyond Black History Month programs. I'm going to stop recording if Linda allows.
Please do.